in your area, there will be OBGYNs and other general practitioners that can assist you for the medical needs of your pregnancy. If you're unsure about who to contact, your case manager can help find medical care for you. Generally speaking, they're not going to need to see you before 10 weeks of pregnancy or so, but we'll make sure that you have a connection to a proper medical care. Pregnancy is so many things. Obviously, many people think about the end of pregnancy and just the toll that it takes on a woman's body, and that is very true. But there are also many joyful things about being pregnant. Several things that you are going to experience. Not everybody experiences nausea in that first trimester, but many do. And trying to manage that, managing your just the circumstances and the emotions that you have with all the hormones that are going through your system. But there are many joys as well, and feeling that child move for the first time within you and knowing what a huge impact you're having on their lives. Pregnancy is many things, joyful as well as some not so joyful experiences as well. But lots can be done through just management of your diet and just walking through the circumstances. What happens to your body during pregnancy, obviously, is you're going to be growing. You're growing another human inside of you. And so the need for your nutrition is going to be very important to make sure that you're nourishing yourself as well as your child. The importance of what you don't do as well, staying away from any alcohol, which is probably the most harmful thing that can be done for to a unborn child would be the consumption of alcohol. So being very careful with that, being very careful not to use drugs that are not allowed during pregnancy. And of course, the medical provider will give you a list of things that are okay that you can take if you get a cold, or Tylenol and that kind of thing are certainly fine. But the body changes. Obviously, you're going to be growing, and so your size is going to be changing. And so that's to be expected. Both obviously, and your belly is going to be growing, and generally women experience some changes to their breasts as well. So there's lots of experiences like that you're also going to feel later in pregnancy when your hips are going to be widening, and some of that can be a little bit painful and disconcerting, but it's all very natural. Emotions are going to be all over the place during pregnancy, and that is just generally a part of pregnancy, whether it's a situation that you've planned or unplanned. There's going to be days where you're going to feel like there's no way I can do this, and there'll be other days where you feel very confident. But to really put on top of that, when you're experiencing a pregnancy that you didn't plan, and you're uncertain about what's going to come next, what I've experienced as a case manager of watching women walk through this is one day they're feeling very positively about the fact that they could maybe parent, that there might be a way forward. And the next day they're feeling that there's no way they can do this. And I'll tell you, the most important thing that they need is a confidant and a friend to help guide them towards, here are the reasons why you are capable of doing this. Or here, let's talk about some of the reasons and the other options that you have. If adoption is something that they're looking at, we can walk through some of that decision-making process. But we do very much expect that there's going to be, today I feel this way, tomorrow I feel the opposite. And towards later in pregnancy is when women really seem to come to decision-making and to really know that they feel that the path forward is one way or the other. Depression can absolutely go along with pregnancy. So in this particular case, when somebody is unsure about what's going to happen, are they going to parent, are they going to place, or there's obstacles that are in their way, absolutely depression could be a part of that. There are techniques that can be used in order to assist a woman who might be depressed while she's pregnant. Of course, a medical doctor would be able to prescribe a medication that would not harm the unborn child. But there's also talk therapy. And we would absolutely connect our clients with potential therapists that can do talk therapy as well. And especially if there's some sort of underlying mental health concern, even prior to the pregnancy, we think that's very important to be able to involve that. Most certainly after birth, there can be postpartum depression, can be, for some women, something that they experience. And the hormone differences when you have delivered a child are a massive rush. And for some, it can really result in just feeling maybe just kind of blue for a couple of weeks and maybe a little bit teary. And for others, it can go on for a longer period of time. Knowing what to watch for, how to interact with your doctor about what's happening with you, and having that relationship becomes very, very important. There's going to be many resources for women who need some help during their pregnancy. First, I would say we would like to be a resource here. We would absolutely love to connect with you specifically in your community to things that you might be able to receive through crisis pregnancy centers that are near you. Definitely your physician. Prenatal vitamins and that type of thing can be given through your doctor's prescription, and then you can get that at your pharmacy. You can also take some that are over the counter. As far as other resources, though, for where you may be able to receive some assistance, such as clothing or other items that might be needed, we'd love to point you in the right direction, but that's all going to be very specific community by community, and we'd love to try and make those connections for you. Here at Many Hearts, we're all about love, and I'm inviting you to reach out to us today and let us help you.